Hello, everyone, and welcome to the session. I am Dr. Ashwani Kumar, and I'm a faculty of human anatomy. And today I have Honorable Dr. Praveen Kumar Gupta with us. He is a renowned pathology faculty. Well, everyone knows him. I just have to formally introduce him. Well, it's a chilling evening in the Delhi, and we are cozy in the studio. And basically, this session here is basically to guide the students, specifically the students who are done with their uni exams of first year and they are in second year and they are looking for some guidance for the subject like pathology. And before we formally start talking with sir, I want to tell that last year, fortunately, we taught approximately 40,000 students across the country. And we are really elated to see the kind of result that we got. We got n number of distinctions, and we are flooded with the messages that how they performed in their exams, and specifically talking about as a faculty of anatomy in the subject of anatomy. So this session is basically like a passing on a baton to one of my very, very dear friend and an amazing faculty. Well, just to tell you a little about Dr. Praveen, sir did his MD in pathology from All Indian Institute of Medical Sciences, New Delhi. And sir has been teaching pathology to the undergraduates and postgraduates for more than a decade. So I'm sure if you go and look around and you'll find out that what kind of legacy the sir is holding. Well, sir, we'll try to keep this session short. We do have some questions with us already, and the live chat is also on. So we obviously will try to cater those questions as well. I first wanted to, because when I taught these students in the first year, it was very new to them. So obviously we started with the very basics here, and there are certain challenges which my subject has, and we kind of try to overcome that. And thankfully, the result speaks about itself. What do you think, sir, pathology, what is the role of pathology in a student's life and in its medical career? And because we are basically catering the second year students here, so I'm sure they started with this subject, but I want you to tell in your own words that what role does pathology have?
Nice, and thanks for a wonderful introduction, Dr. Ashwani sir. Yes, it really feels nice when one of your friends introduces you in such a great manner. And just coming back to your question, sir, actually when you talk about pathology in a medical science, the basic role is diagnosis. Yeah. That's when you talk about the medical science, when you practice pathology as such. But when you come to the MBBS curriculum, pathology has 4 basic parameters. One of them, it talks about the etiology. Etiology, that is causation of a disease. So once that etiology has happened, it talks about the pathophysiology. So pathophysiology is one thing which actually is the reason how the disease got into your body. So what changed in the body and with mechanism behind it. That's called as pathophysiology. Then we talk about the morphology. Because of the disease, what is the morphological events happening in every organ or every tissue or every cell in the body. And finally, because of that morphological change, what is the clinical features that can come out of it. Now, clinical features do also include the prognosis. That is, we talk about the outcome, whether it's good or bad, what can happen because of that particular disease. So the 4 things that we talk about in pathology as such. And not to say, because when you know these 4 things, if you add a pharma in this, the only thing remaining here is what exactly was the etiology, and that is what microbiology is. So when you talked about a very prudent question, sir, you talked about what is the importance of pathology as such. So yes, in medical science, it's about diagnosis. But I would say in a second year student or any MBBS student, this is what it is. You talk about the disease, you talk about the etiology, you talk about the treatment, that's it. And that is what is being, they actually study in the final year in medicine and surgery.
Now, like say in first year, students are not mature enough to like kind of integrate anatomy, pathology, physiology and biochemistry. I think second year is 1 year where there's a very good amalgam of micro and path and pharma, and that this has been said that people who are good in their second year subjects, well, they definitely will not have a problem in their final year. The medicine life will be really good. Well said.
Sir, but I'll just ask you one question back to here. We talked about integration here. Sir, would there be any subject as a basic subject which would be taught without integration? When you talk about anatomy yourself, you might have taught the same thing to first year, even though they're very immature, but I'm very sure you might have introduced many of clinical things, clinical scenarios in front of them, because that is what makes them realize why are we studying the disease.
Exactly. That why is important,
That why is very important. So the integration is important, and any faculty, I would say, he always ensures that the clinical importance of the topic is well said in that topic that he's teaching. And when you, sir, would you be giving some examples that you would talk to this first year?
Well, like for example, if I say when we talk about the radial nerve, so I kind of showed them certain cases that okay, there's a patient with a wrist drop coming in. So it's like we try to give them a scenario that you have a patient walking in, there's a different kind of gait pattern or some deformity is there. And then based on that, you have to fall back to your subject here. Although you'll be reading all these things in your orthopedics and on your surgery part, but then you have to fall back to your basics only. I know that wrist drop is there because there are extensor weaknesses there. So that brings you like that kind of feeling is there. Okay, why am I reading anatomy? Is it just to write a short note or just to answer some questions, or is it like will it be of any use to me during in my medical career? So what I tried in my first year, and I'm sure my students will also agree with that, I usually try to show them a picture that okay, this is the reason we are reading the subject, and the moment they kind of understand what is the motive behind it, they found it more interesting, they were more engaged, and their enthusiasm was different, and they never found it as a subject which is like loading their head. Generally, people are very stressed with the subject like anatomy and pathology for that matter in second year, but thankfully it all went well. Well, sir, I need to ask you that what should be the approach of a student as a second year student, like keeping apart every classes and all that. If I'm a student, let's say I'm not attending any class, so how should I approach this subject? Because there's a way to go about every subject. What do you think, sir? How should they approach it?
So guys, as such, when you talk about my subject, I'll try to deal with every subject in just short. But when you talk about pathology as such, the initial few chapters that belongs to general pathology. And general pathology is about the cell and how does the cell behave when any injury is affecting a cell. So when your base is right, the base talks about general pathology in which the cells changes based on the injury is being taught in those 7 chapters. It's not about cell. Don't take it as cell only as a cell. It can be a cell, it can be a gene, it can be chromosome, it can be immune system. So a lot of things are there. And just to name those topic as such, it is cell injury, it is adaptation. The second chapter about inflammation, immune system, repair, regeneration, and genetics. And along with that, neoplasia tumor. So once you know these basic facts about general path, understanding systemic component of the same thing becomes very easier. However, what happens, I will say this, sir, I'm very sure you will asking me this question also, what is a basic problem from a second year perspective that students do face? So what happens, sir, if you look at the second year being taught in medical colleges, with all due respect to my own faculty who have taught me, and they really taught us all brilliantly, on one side they start with the topic of cell injury, and on the other side they start with the topic of amyloidosis. The third faculty would come and teach a topic called as diabetes. So this whole way of approaching a subject is completely, wavered. And a student who is not knowing a cell, giving him a topic called as amyloid. Amyloid is something which you realize that it's a effect of so many diseases. So in my class, I would personally teach amyloidosis at the last, because that is one topic. Similarly, diabetes. Diabetes is not just about increasing glucose metabolism, which you talked about NCRT in class 11th and 12th. There's so many organs affected in diabetes. And so again, this is a disease which you should read after you read every other organ also. So the same problem also may occur in in pharma. If you don't read about the general pharmacology very well, you don't know about the biology. Just as an example, there's a drug and the biology of the drug is very high. It means the drug is spreading throughout the body. It means the side effect of the drug is very high. So if a student knows that what is bioavailability, and if a drug has high bioavailability, volume of distribution is very high, so what will happen is he gets to know that this drug will particularly cause a lot of side effects. So knowing this general part, and same thing also with microbiology, these 3 subjects has 3 components, and general anatomy is also like that part of it. The general microbiology, general pharmacology, and general pathology, there are some things that you should read first of all, make a very important base out of it, and then build upon the same thing by reading systemic pathology and then also hematology.
So basically, sir, as I rightly said that with all due respect in medical colleges, because they have a curriculum to take care of, so generally they don't follow a certain sequence. Like also, I always say in my classes also that for me, my sequence is very important. Like if I have to take care of this subject, I need to start from a corner. And when I discuss the second topic, third topic, I should be able to relate to the first one here. I cannot parallel start with the 4 topics altogether here. And well, we already talked about the kind of challenges that a secondary student will face. Like in first year, we all know that how we read histology and how everyone reads histology, and now they have to watch the slides of histopathology. So, sir, what do you think that what kind of challenges? Because some people who are very new to it right now, what kind of challenges they are going to face in their second year when it comes to pathology? कौन से ऐसी चीजें हैं जो which will kind of hamper them?
Let's come to the viscera and bones of first year. So when you took the bone first time in your hand, you were like, ये bone ही तो है, ये femur है, tibia है, but then you got to know there's so many tubercles, there's so many attachments, and that is how you build upon your concept. The same thing happens when you look at the histopath. So histopath is all about knowing the histology very well. Matlab, let's say you are looking at a slide of alveoli in lungs. So if you don't know the normal alveoli and then the branches leading to alveoli, like I don't know how many of you know that bronchioles are going to the levels of bronchioles, then it goes to terminal bronchioles, respiratory bronchioles, and then duct and sac. If something happens to sac where exactly to look like or look where in the slide, you know, the same question also was asked in this year NICT, in the November NICT. This marked a image of histology and just made a drew an arrow pointing and asking you which part of bronchiole it is.
Okay.
So the same thing, when I talk about ARDS, example, I just take an example of ARDS in pathology, I talk about this is the part of the alveoli, but how does the alveoli come across? I show the histology images. So once a student is well aware of the histological images, then they can understand the histopathology very well. But having said that, sir, I would again point a very important fact that is not only important to know the histology. Matlab, you will understand the importance of histology only when you know why you're reading that. Just knowing the histology of pancreas is not helping you unless you know what you should see in pancreatitis and what change you should see in acute pancreatitis or chronic pancreatitis, right? Like for example, sir, gallbladder. Gallbladder, what we teach is as such, the submucosal layer is absent in gallbladder. अब बच्चे को पता है नहीं कि submucosa में what exactly to look at, where are the crypts seen, where are the villi seen exactly. So that is one problem, and I would say that isolated reading of histology is not so important. Reading histology along with histopath is more important. So what we would be doing exactly, I tell you, sir, once I show you any slide of histopath, I will surely ensure that I'll show you one side of histology, normal histology, and then I'll compare the same histology to histopathology. Because unless you don't know the histology, it becomes very... Even if you have read this in first year, you will forget it here.
And moreover, sir, in first year, I mean, gross anatomy, still people kind of correlate with the clinicals better. But when it comes to histology, for them, it is just like one short note which will come in the exam. You have to just draw a circle and put an HNE and you have to just get those marks in that. Like people it's very difficult for them to kind of correlate with the histopath, because gross anatomy is something very visible here. It's microscopic anatomy. How will he understand the pathology when he doesn't know the non-journal histology? So basically, sir, is going to be your connecting link between the histo part also and even the pathology also. As I said, there's no point in only reading histopathology. The differential is also important when you look at certain slides. So, well, sir, with that, I want to continue in this question only that what exactly are like me and you, like what you bring to the table when it comes to pathology. Like, as I said, the lectures are going on in the college also. People are reading by themselves also. They're reading textbook also. They don't know where to start from. So how will you make their life easier in pathology? Seriously.
Achha, this is a very, very important question. You know why, guys? Let's say many students ask me, sir, how many hours are there in your lectures? And I would say hours are not at all important. Not at all important. What is important is that number of hours you're putting yourself into the lectures, how much you get out of it, how much you understand from those number of hours you're putting into. And just merely watching a video once will help you to only understand it. But to memorize this, you may have to watch it again and again. So coming back to the question that sir asked me, what we would bringing to you as such in pathology. So as I told you, I will first teaching you the general pathology part, in which there are around 7 to 8 chapters. And then there are 3 chapters of hemat. And when you realize that when you read hematology from pathology, you may or may not read the same chapter from medicine. Because everything about hematology is about pathology. And when you read the certain pathology part, there's so many students, sir, so many, I would say, and all of them who get a very good rank, they always said one thing. My first and second subject were very strong.
Yes, absolutely.
Why do they say that? Let's understand the basic core of that statement. That my first and second subject are very strong, and therefore I actually get this rank. So what happens is when your first and second is very strong, you can put more effort into understanding the disease, and the final year part is actually used to learn the treatment part. And not only, again, the disease, again, coming back to the same thing. For example, cardiomyopathy. It's a core medicine topic. But cardiomyopathy is being taught by us in around 45 minutes from pathological point of view. So the only thing to add there is the treatment part is beta blockers. And the complication which can be arrhythmias and how to treat the arrhythmia is being taught by in the medicine part. So what will ensure here is I will try to cover every aspect of etiology, the pathogenesis, and also the morphological change in pathology, and also mention at least the main points of treatment. Not exactly the details of treatment, but at least the main points will help you to correlate the same topic to medicine part. And even if you don't, you don't get that time, and second year is completely fine. If your pharma is very well, again, that thing is also sorted out. So I'll ensure that, sir, this thing is very well taken care, that we'll also at least talk about few of the important treatment part, even though we're not obviously available because of the time that we have, but that should be done, sir.
Yeah. And so, I mean, I always say that pathology is all about reasoning. And once you understand the reason behind it, then you find it like more interesting to read that medicine. Even whenever other faculties like Dr. Tamim and other pro faculties who are teaching medicine, they always started with pathology itself here. So why not to ensure that you have a very good grasp of the subject in the second year itself, when you have all the time in the world to read it here. And again, I want to emphasize to our viewers about one thing that I always say this to my student, that we are not here to say that, okay, you are relying on our videos completely. You should not be reading the textbook. If you are a second year student, you definitely should be reading your second year books here. Everyone is a fan of Robbins, I'm sure. And even sir, he always encourages students to read Robbins here. But the point is, once you attend lecture, and you must have felt this in your first year also, it becomes easier for you to understand that. That book requires like a pre-understanding, a pre-knowledge to go into that language and understand it. And that is provided by these lectures here. Let's say you read the inflammation with sir, and then you go back and read it from any book here. You'll find your life easier, and you are able to correlate it well, and that will save a lot of time.
And so that's a good point about first and second year. You have a defined book.
Exactly.
And that book is readable. No one would say that Robbins cannot be read.
Yeah.
But the same matter, if you talk about Harrison, I would say everyone would have a doubt whether you can completely read the Harrison in and out. That's not even possible. That's a very huge book to read from an MBBS perspective. Yes, you can read this when you do the MBBS later on. So that is very important. Every subject of second year has a book defined to it. So Robbins for pathology, there is K.D. Tripathi, even Javed as such for pharmacology. Katzung is, not Javed, sorry, Katzung is one book which many students would read. And for microbiology as such, there's Anant Narayan Panikar is a very good book. And some students would also add up to K.D. Chatterjee is also a parasitic book that is also a lot of students would actually read. But as said, very rightly told, there should be some pre-knowledge required to read those books, especially Robbins, because not an Indian author has written this. So the language is so tough, sir, somehow, honestly speaking, when I read Robbins even now,
every time we find something new.
Oh my God. The Robbins is such a beautiful book, sir. When I talked about this statement, it creates so much respect to that author.
Exactly.
How much intricately details have written this. And once you read this again and again, you get to know in between the lines what they meant by the statement, which I didn't read beforehand. And this, I cannot, tell you to read Robbins line to line, but I will ensure that that knowledge that I've got throughout the years of reading this Robbins, I can translate the same thing in an easier way, in a more palatable way to you. And that's what we bring to the table in the lecture form with the handwritten notes that we prepare. And you can also make your own handwritten notes, and that would be, reflecting of the same textbook. That is Robbins. We will not encourage not to read Robbins, but make that thing so easy, you will actually go back and you want to read Robbins there.
Yeah. And sir, I mean, obviously, being any second year student, they will have this thing in their mind ki, at the end of the day, we have to give a university exams,
right.
Of course. So, एक misconception जो रहता है, generally when we talk about any coaching platform, coaching platform is to teach on the need basis. So our viewers, we should know that, because the many students who might be watching our video which are like new to this, we do have a PG section which is separate, and we do have this concept video which is separate here. Sir right now is talking about the concept videos in which he is teaching pathology in quite a detail, and definitely taking care of your university exam also. He also will keep guiding you in between, that okay, if you get a short note on this or you get a long question on this, how to attempt it, how to write an answer. The presentation is also important. At the end of the day, you have to write the answer and you need to fetch the marks in your university exams also. So sir, थोड़ा सा आप भी just clear it out
मैं
to the
एग्जांपल
viewers
देता हूँ,
here.
बहुत 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 इंपॉर्टेंट क्वेश्चन है सर. जैसे कि लेट्स टॉक अबाउट अ टॉपिक, वेरी सिंपल टॉपिक ऑफ नेक्रोसिस. ओके, अब नेक्रोसिस में देयर इज समथिंग कॉल्ड एज फैटी नेक्रोसिस. ओके, एंड देयर इज आल्सो समथिंग कॉल्ड एज क्वालिटी नेक्रोसिस. तो व्हेन आई टॉक अबाउट अ नेक्रोसिस कॉल्ड एज क्वालिटी नेक्रोसिस, it is caused by Zenker's degeneration. Now, this statement as such, what does it mean to your second year student? ये क्या मतलब है Zenker's degeneration? You may have to Google this stuff up, right? So when I talk about in the concept videos, I will ensure I tell you what exactly is Zenker's degeneration in at least in one line. The same thing about the fatty necrosis. One of the cause is acute pancreatitis. I'll tell you what exactly the statement means. What is acute pancreatitis? Let's say I'll talk about malignant hypertension as a cause of fibrinoid necrosis. Malignant hypertension, मतलब क्या हुआ? It is a tumor with hypertension? No, not at all. So I'll exactly tell about what is a definition of malignant hypertension, and it's what is concept video is all about. So when I say a statement or a word which I know that a second student is not very easy for him to understand, I'll say this means what. And this what makes this videos a more, I'll not say exactly concise, not the right word. I would say it is more easier for you to follow. Like if I talk about Alzheimer's disease or Parkinson's disease, many of you know it's a neurological disease. But what happens there? So I will talk about at least 1 or 2 lines about these two diseases when I name them in my lectures in concept videos. That is how it makes it different from regular videos, and therefore for a student who is in second year, we would encourage them to watch a concept videos and not regular videos there.
And well, thank you, sir, defining with such a wonderful example. Sir, one more thing, like for example, when students are reading like anatomy first year and elaborately, and then they'll read pathology in the second year. Like when we were preparing, we had no guidance in this regard. Ki, okay, how much the subject we need to carry forward, because at the end of the day, we need to clear a PG entrance examination also here. So at times, people, I got this question in my Telegram when people knew I had a talk with you, and they wanted to know this. Sir, will you be also guiding us that what we need to carry forward from this? If I'm like reading a topic in detail, then how much out of this, once I'm done with my second year, I need to carry it forward, which will help me to build my concept also, and will also be important to crack that entrance examination also, because I need to shut down my the content also.
I believe that this question I should also ask sir himself. When one student passes first year, what is the best way to revise your brilliant notes that is written? Because the next time you're taking these notes is an internship. And this 4 years gap is a huge period to forget anything. So what's your perspective, sir?
Well, sir, I think it kind of changes once the exam approaches, because, by the time the 4 year will pass and the exam will be clear, they will be aware of that what is being asked in the recent trend, like the previous 3-4 year questions, what are the previous year questions being asked. And obviously it is always being said that whatever the previous year questions are, we need to like read around those topics here. So that is one thing here. But there are certain things which are important, were important, and will always be important. I'm sure that is some with the pathology also.
Right.
The topics which were asked in 1990s also, and they will be asked like 100 years down the line as well. So during these classes, my main motive is to emphasize on the topic ki, okay, this is something, you have to carry it forward. I just said, okay, sciatic nerve injury, a foot drop, radial nerve injury, there is a wrist drop. Now, these are the very basic that you have to carry forward. If you don't know too much about these nerves, then at least know, okay, what are the major features of these nerve and injuries that you need to carry. I think the same goes with your subject also. The things that you need to carry forward, like I do not expect a student in the final year or like intern or post-intern to remember the attachment of the fibula. Well, that's not possible. That is like for the university exam in the first year itself, and they have to leave it there, because that probably is not going to be helpful in their medical career. So same thing, I'm sure with the pathology also.
Actually, sir, pathology as such, he has to read on multiple occasions in final year as well.
Exactly.
So when you read medicine, if you have read pathology very well now, you'll always want to go back and always read your second year notes. I can tell you this thing. And any student who's in final year right now, if he's watching this video, or he may watch this video later on, he would also agree with this fact that if he has made a very good notes of pathology, especially hematology and systemic pathology, open up that part when you read any topic of medicine. And same thing, also go open and read the topic of pharma if you have read and been reading that topic in medicine or gynae-obs or in pediatrics as such. For example, when you read nephrotic syndrome in medicine, just go back and read the topics of pathology and treatment from the pharma and only then read nephrotic syndrome from medicine. It will really make your entire thing, I'll say, easier by not less than 50-60%. And if you don't believe me, ask your seniors. And every senior, sir, I'll tell them one thing. If your first and second subjects are very strong,
Exactly.
don't even bother about the NEET PG. You're going to get a better good rank.
And especially looking for the central institute. The more the exams are central institute oriented, INI-CT, it is a very commonly said fact that pre and paraclinical is good, and you're going to get the good rank in it.
In fact, for FMG also, even though FMG is not our main discussion, yesterday was the FMG exam, a lot of questions actually came from first and second year.
Yes.
And same for INI-CT, maybe the NEET PG this year. So they ensure they ask you some basic topics on which they build upon and ask you other questions.
Like one of the student actually, Dr. Kapil has commented about that anatomy was good and pathology was good. The questions were easy. Well, you found it good because you read them well. Because generally, even the most basic questions in the anatomy, people find it really difficult because they haven't read the subject in a long time.
True.
So, well, that's good on your part. Sir, I'm going to take one more doubt from here, which is probably targeted to me only. That's before starting the second year, should I revise the first year? Well, I would say no, to be honest, because you're done with your first year right now, and you should be like completely diverting your energy and completely focusing on the second year subject. Start your second year subject early when you're done with the first year.
There's one more reason for this. Sir, when we used to prepare, we had 1.5 years in second year.
Yes, sir.
But things have changed.
No, exactly.
So now things have changed, and because most of them are from the new curriculum, they would be given 1 year for first year?
Yeah.
Or it's 1.5 year now?
It's a little more than that here.
So it's around 13 months for first year, 12 months for second year. Now you have 1.5 years in the final year.
Yeah.
So because previously there was honeymoon period was second year.
It was.
Why is honeymoon period? Because the first 6 months you just used to have fun. You used to encourage your juniors coming up in the medical college, taunt them, and also treat them in a good manner, whatever. Whatever sarcastic way it means. And then you used to also have freshers for them. And after 6 months have passed, you used to buy some books. And after 6 months of buying the books, we used to go to our seniors, get them underlined, tick marked.
Exactly.
And after getting it tick marked, in the last 3 months when the exam approached, we used to read it.
Yeah, exactly.
Now things have changed.
Exactly, they've changed. Well, I think the plan is to keep this session short only. Guys, I mean, what is the crux of this entire thing is that, and especially I can say this to very confidently to my students who studied with me last year and they found their life a little easier in the subject. I hope they did. That it's not that we are working on a certain platform and sir is a very good friend of mine. Well, it is our kind of moral responsibility also to show you the right path. And when I see sir teaching pathology, like I've been kind of watching his videos at times, and when he takes live lecture, sometimes I peek into those classes. Well, I kind of get motivated to read pathology. I want to know more about it here. So, that kind of enthusiasm is required, and that is only taught by a certain teacher who can do that to you. I'm pretty sure that if you read pathology with the sir and the people who studied the pathology with sir in the past history, be it a second year student or the people preparing for PG entrance examination, they really loved the subject and they completely followed it for it completely. And they really found their life very easy in the later half. Especially the final year is very taxing. The subjects like medicine, surgery, obs, gynae, there are huge subjects here. And you cannot invest all your time onto one subject itself here. So if you're good in anatomy, obviously the surgery part will get a little easier for you. The same goes if you're good at pathology, your life in medicine part will get easier. And that's what the sir is going to bring on the table for you. Dr. Kapil has just said, yes sir, first year's strong concept clear, easy PG, FMG exam without concept problem. Yeah, exactly. So a student is asking that which video should we go for, concept or PG video? Well, sir, आप ही answer दीजिए
देखो, it all depends upon which year you are.
Yeah.
If you are in second year, was the concept videos.
Absolutely.
The moment you have passed second year, was the regular videos. In whichever now you are, maybe you're in third year, maybe you're in final year, maybe you're an intern, post-intern. Once you're done with second year, don't watch the concept videos because now you know something about that part. So I would then tell you to watch the regular videos. As such, if you are in second year, do not watch regular videos. Again, that's one more thing. Let's talk about this. Yeah.
And moreover, like if my students will watch my PG videos, it's very easy for them to correlate because they read anatomy with me for the entire year. So like changing the source at this point of time for them may not be a good idea. Although everyone is doing a wonderful job at different platform also, but if any student of mine, if he'll ask me, okay, sir, should I like watch the PG video now because I've done with the first year? Yes, one should go for it here. You should not be changing a platform unless you find like something you're not able to understand that.
True.
The same thing for you, that if somebody's done sir ka agar kisne second year subjects kiya hai, so I think they should watch the PG video because that will be really easy and the subject will go really fast for you. You'll be able to finish it in a less period of time.
And probably we, as such in Gurukul, are the only institute which brings upon this concept video concept to you. And there's no other institute as such offering this. And the reason behind that, because we have been dealing with so many students in the intern and post-internship phase that we knew what exactly they faced a problem when they were in second year. In fact, because we also have passed on the same problems, we know that why was it not easy for us to read those subject-wise textbooks in second year, and we resorted to the small chotha or small, notes circulating before the exam of few pages. So that's only good to pass the exam. That's very well. You should do it. You should do it. But that should not be done at the cost of reading a textbook.
Yeah.
Guys, in second year, first year, and final year, we always encourage to read the textbook. And if you watch our videos, reading that textbook will become very easy and also become more and more fun.
Yes.
Because, sir, would you not suggest a student who has a Gray's Anatomy with them, and then watching your videos, you want to actually refine the entire big images into small images.
Exactly.
So the content decreases.
Yeah. Because like we generally take an example of a Netter's Atlas. When you look at the Netter's Atlas, that you kind of feel, okay, I'm not going to ever understand this image. There are so many hundreds of labeling present inside here. But once you've attended the class, you know, okay, what to look at, where to start from here. You get to get a way to get into the image and way to understand the topic.
True,
here.
very true. In the same thing also goes for the dissection videos that sir has posted in the YouTube. You go back and watch it, you'll understand why it is important to the dissection videos, not only for dissecting a cadaver, but also to know where exactly the nerve lies in the medical system, where exactly lies it. So that's why you should watch those videos to have a very good concept here.
And in fact, sir, this concept of we should record this concept video. This idea actually came from this fact that whenever we whenever we go to take the classes, then the student gives the feedback कि काश शायद सर मैं आपसे second year पढ़ा होता. If in 5 days I can learn so much of pathology, what could I do if I were like the entire year pathology आपसे पढ़ा होता. The same goes for the subjects also. Yes. So that was a point where we thought, okay, we should have a system where we should be teaching our first, second year subject student as well. And well, it is working very well. I hope that that you people get to see sir's video, and I'm sure that you will be thanking me later.
I can just tell you this one video of general pathology. Those who are watching this video, we'll try to put a link of that also in the comment below. Just watch that video on YouTube, decide for yourself what you need to do, and then if you have any doubts, do connect to me on Telegram. I have the same name, and also comment on this video below once the video is done, and I'll surely attend and surely answers your doubts that you anyway have even after watching this video.
Well, thank you so much, sir, for your time. It is always a pleasure talking to you. Okay.
Thanks a lot,
and,
sir.
I hope that student got a clear idea about that. Okay, if you're from first to second, then how you need to approach those lectures. Thank you so much.
Thanks a lot, dear. Thanks a lot, sir. Thank you.
Sir.